Good afternoon, Dr. Ron Ehrlich. We are looking forward to having a chat with you today. We were talking about breaking news and how it's become a little bit, so many people use breaking news these days, it's become a little bit like the boy that cried wolf. So we had a bit of fun with it last week, and every time we get some breaking news on the screen in the studio, I sort of break and say, breaking news, breaking news.
Well, I'm holding my breath.
Yeah, exactly, and it's always something boring like Scott Morrison's going to stand in front of a pulpit at 1:30 and tell everyone how wonderful he is. Dr. Ron, we're talking about breathing today. I've got to tell you, my wife, we spoke before, and you sent us some books, and we gave the books away because Dr. Ron wrote A Life Less Stressed, and you sent one for me, and I have read it, and it sort of goes into the cupboard, and my wife was looking in the cupboard and she found the book and she pulled it out on the weekend because she enjoyed our chat last week, and she pulled it out on the weekend, so she's now reading A Life Less Stressed.
Good on her.
Yeah. We're talking about breathing today. Now, when people say breathing, what, breathing? You're going to talk for 10 minutes about breathing? We forget how important breathing is. But it's not just breathing in and out. You have to breathe correctly, don't you? In and out.
That's right. I mean, we could talk about breathing all day, actually, because there's a very big difference between just breathing. I mean, I think I've said this before. The secret to living a long life is to keep breathing for as long as you can. I don't think that's a major breakthrough, but there is a big difference between just breathing and breathing well. And to understand that difference has all sorts of implications on practically every system in your body, physical and mental.
Tell me, what is breathing well? How do we breathe well?
Well, noses are for breathing, for a start. So that nasal breathing is really important. If people who breathe through their mouths, mouth breathers, are missing out on a lot, because our noses are our built-in air filtration and humidification system. If you breathe through your nose, the air is warm, humidified, and filtered before you take it into your lungs, making you much less susceptible to allergies, asthma, and respiratory problems. So slow breathing. When you breathe through your nose, there are essentially 5 levels of filtration. There's the fine hairs, which filter out the particles. There's the mucus lining the sinuses and the turbinates and the nasal passages, which kill bacteria. There is the adenoids, there's the tonsils, and there's also something that is produced when you breathe through your nose called nitric oxide, which is 60% of the body's nitric oxide is produced in the nasal passages only when you breathe through your nose. And get this, Brent, after the SARS-1 pandemic in 2005, they did a study which showed that nitric oxide had the ability to disrupt the reproductive cycle of the Corona 1 virus because it's antimicrobial. So actually, if there's ever been an important time to learn how to breathe well, now is it. So breathing through your nose is important. The other one is to breathe slowly and gently. It's considered that normal breathing rate, and this is probably true, that most people do, breathe about 20 breaths per minute. But ideally, I think this has been borne out by lots of research on stress, that if you can breathe 8 to 12 breaths per minute, that is going to have a significant calming effect on your whole nervous system. So slowly and gently is important. And the last thing I would say in breathing well is we've got a whole set of lungs, so why not use them all? And that's why breathing from the diaphragm is so important. Rather than pulling the chest up and down through your neck and shoulder muscles, using the diaphragm to slowly breathe 8 to 12 breaths per minute has so many. The more I learn about the diaphragm, Brent, I actually had a conversation with a gastroenterologist who was talking to me about heartburn and reflux and indigestion, and he said he thought it was a muscular problem, not an acid problem, and that's about the diaphragm being well-toned to stop reflux from occurring. And I had another conversation with a men's health specialist who said breathing from the diaphragm improves pelvic floor muscle tone, which for anybody who's had a baby or anybody that gets older, and by that I mean over the age of 40, and is concerned about urinary incontinence, pelvic floor muscle activity is important. So that's it. Nasal breathing, slow and gentle, 8 to 12 breaths per minute, and from the diaphragm.
How important are breathing exercises to do?
Well, I think that's really powerful. They're very powerful. You know, we hear a lot about being stressed, and there's a part of our nervous system that is the fight and flight part of our nervous system, which we should only be in for a short period of time. And there's another part called the rest and digest part, which is the parasympathetic nervous system. If you breathe slowly and gently and hold the exhale breath just for a few seconds, so you go 4 breaths in through the nose, 4 seconds in through the nose, 4 seconds out through the nose, hold the exhale breath for 4 seconds, so that's 12 seconds, and you repeat that 5 or 10 times, that means 1 or 2 minutes, you can switch on the parasympathetic nervous system just like that. So it's a very, very powerful thing. It's an integral part of almost every meditation practice. It's a really important thing. That's a worthwhile thing to explore, and to be conscious of whether you're breathing through your mouth or your nose.
What about breathing now that we're in the COVID-19 pandemic and everyone's got to wear a mask? What about breathing with masks?
Look, it's a challenge, and I think one of the most disturbing things about the current information we have is that the transmission occurs through aerosol spray, which means particles that hover in the air for an extended period of time are then potentially infectious to us. Whereas droplets, if you cough and a droplet falls onto a surface and someone touches that surface, that's a problem. But I think masks are important. I think it's a challenge. Look, I've spent my whole professional life with the masks on, so believe me, I know what it's like. But I think we have to weigh up the risks. And if we're in a space, I think you are better off wearing masks, whether you wear them outside or not. I'd leave that up to somebody who knows a little bit more about it at the moment, because this is all breaking news, more or less. Sorry to use that expression.
Yes.
But I think masks have a really important place. And to people that are skeptical about masks, I ask them this simple question. Tell me, when you cough or sneeze, do you bother putting your hand in front of your mouth or nose? And the answer is obviously yes, they do. And the question is why? And the next one is, when you go in for an operation or you go in to see your dentist or hygienist and they're hovering over the top of you, would you rather they had masks on or not? And the question is why? So I think when we answer those two questions, it makes for a little bit more of a compelling argument to at least wear it inside, when you're in a space with other people. But outside, I'm still not quite sure about that one, Brent. So
do you breathe through your nose or through your mouth when you've got a mask on?
I try to always breathe through my nose, because I'm always filtering my air. You only breathe through your mouth when you don't want your air filtered.
Right. That's a good way of thinking about it. You only breathe through your mouth when you don't want your air filtered. And if you don't want to breathe through your mouth at night time, as we've said before, you can buy some medical tape and you tape your lips closed. And you'll get used to it, and it does wonders for you, doesn't it?
Well, I suggest before you do that to just take a little bit of the tape while you're watching TV or reading and try it. Slowly and gently breathe through your nose. Don't do it just before you go to bed. Do it while you're watching TV, and be surprised that you can keep that on for a half an hour or an hour without any trouble. And if that's the case, then wearing it at night is okay. For people who are struggling, you need to find out why that is the case. So it's a little more nuanced, but it's a nice thing to at least try while you're working or watching TV or reading.
And if you try it and you like it, it's like everything else. You'll never go back.
Well, I always say, people say to me, I've been using tape on my mouth for 15 years, and I also have a snoring appliance. It's quite a ritual in my bedroom just before we go to bed. But anyway, I say don't only wear tape on those nights that you want to sleep well.
Yeah, very good, very good. I've got to go to the news. It's always good to talk to you. We'll catch up with you next week, Dr. Ron.
Thanks,
Don.
Bye.
That's Dr. Ron Ehrlich. And as I said, he wrote a great book. It's called A Life Less Stressed. You can get hold of it on his website.